Okay, thank you, Taylor. What I'd like to ask all of this morning's speakers to please come back up to the stage so we can have a question and answer period. For those of you in the audience, if you'd like to ask a question, please raise your hand. We've got folks that are bringing microphones around. We are trying to record the session, and so we want to make sure that both our panelists can hear, but also the folks we're also live streaming this, that the folks on the internet can hear as well. I'd like to start by just thanking our speakers this morning for incredibly diverse and also in-depth presentations. Thank you very much. And I think one of the overarching themes here is a holistic approach to these things, not just diving down as deep as we can in a narrow way, but also understanding how everything that we're doing relates across disciplines and across cultures. So do we have any questions right now from the audience? Oh, wait, hang on, Gracie, can you? Thanks. Hang on just a second, Shannon.
Thank you. I'd like to ask the microbiologist. So, you know, from a community and a holistic point of view, we value animals in our world. And they're part of our families. Some of them sleep in people's beds and everything else like that. But from a microbiological point of view, you know, I'm kind of glad I've got outdoor cats and that kind of thing. So where do you find and how do you recommend people or communities find the holistic part of interacting with domesticated animals who are intimately involved in our lives?
That's a really good question, and one that, you know, the pandemic really came into play where a lot of individuals started recognizing, you know, how important it was to have those domesticated animals as part of our lives. As a clinical microbiologist, my family always said, well, there's no inside dogs because I just know too much. But as a practical purpose, especially as I'm coming up with significant number of antimicrobial resistance, you wonder, how do we make that balance? And so, you know, it's always those things we're always taught. You know, make sure you wash your hands. Make sure that, you know, when the dogs come in, that you clean them up. If you're a good, you know, are you changing your sheets? I mean, we're not necessarily going to colonize exactly everything that happens to it. So I would never tell anyone, you cannot bring your domesticated animal. They can't run around in the backyard and not come back in. It's just if they run around the backyard, it's just recognizing that that can transmit. Where I concern quite a bit is our veterinarians, who are often at risk for colonization when they're handling wild animals, our agricultural industry, and those individuals that, as part of their workplace, are constantly in contact. But with your dog and your cat, I think it's great. I really wouldn't let them lick you, but, you know, as long as you keep them clean, it's so much part of our personal health that I would never say you can't. But as a clinical microbiologist, be careful out there.
We've got Antti and then Dave.
Yeah, Antti Oksanen, Finnish Food Authority. Dr. DeBess, I wonder a bit about the developmental stages of ticks. When in Oregon you have tested and you're going to test differently nymphs and adults. What stage is the most dangerous for us human beings?
Yeah, thank you for that question. So in ticks, when we look at ticks, we look at, it's pretty close. We look at 3 different stages, right? We look at the larvae, we look at the nymph, and we look at the adults. And according to the entomologist and specialist, nymphs are the ones that actually pose the greatest risk to a human or an animal in terms of the transmission of Lyme disease. If you think about an adult tick, an adult Ixodes pacificus tick, it's about the size of a sesame seed. If you think about a nymph, you think about a quarter of a sesame seed, which most of us are not going to be able to detect, even if we actually check ourselves on a regular basis after a hike or being outside, whatever happens to be the case. So, you know, I'm taking it back to what I talked about in our study, in which we looked at different percentages of positivity rates in ticks in different areas. We're now collecting nymphs, which are really what we consider to be the greatest source of infection for humans and animals, to understand the significance of transmission in the animal and human world. Thank you.
Yeah, thank you. David Payer, National Park Service. I had a question for Simeon, William, and Stacy. First of all, I wanted to really thank you for your presentations. I was very touched by the description of the bird that told you of an impending family death, and then the other ways that the animals were speaking to you and telling you about the conditions. And you know, as a wildlife biologist, professional wildlife biologist, throughout my career, I've really benefited from technology, you know, and over the course of, you know, the 25, 30 years that I've been doing this, the technology has rapidly advanced to the point that we barely have to touch animals anymore, it seems, and we use, you know, we have satellite collars that download to the internet, and we have remote sensing, mapping, and it tells us a tremendous amount about the animals, but I think we miss a big part by not living with the animals and seeing what they see and knowing what they know. And so I don't really know how to phrase a question, but you know, Arlie talked about the co-production of knowledge and to try to envision how we can accomplish that. And I just wonder about your experience in working with others that are involved in wildlife conservation and wildlife science, and how we can effectively work together to protect these animals and to make sure that they persist, and that our relationships with those animals that are so vital can persist. If you have insights, I'd really appreciate hearing them.
Oh, you want me to hold it for you?
That's the question I have, and I think that's one of the challenges. Maybe one health, one future, and we talked about this a little bit yesterday, and how maybe this would be something that maybe both the agencies like that and our partners in our communities can tackle. And I think this is one of the things that should be a focus of One Health, and I think, and I think it is, Arlie.
And I just need to give one plug. I think you asked a really good question. I loved Billy's answer, and that he has that same question as you. But I do want to say one of our newest initiatives in the Center for Alaskan Native Health Research, in partnership with One Health, but with Dr. Karsten Hofer, we worked on a proposal to the National Heart-Lung Blood Institute to put together, there was a call to establish statewide alliances for community engagement around climate change and health. And so we put in a proposal where we would engage rural communities and develop a statewide alliance that would be focusing specifically on that really critical conversation between natural scientists, wildlife biologists and managers, and indigenous communities. And so we have that proposal. we got that award, and we'll be building that alliance. And I just wanted to say that it's just such a vital question. And Billy and Simeon are co-investigators on that project, and we're excited to see it roll out. So I'd love to get your contact information to be part of that. Did you want to say anything?
Hi, good morning. Josh Glasser from the State Department. First off, really amazing job pinch hitting with a keynote talk. I thought you laid out kind of a very interesting hypothesis about this idea of crisis triage and how do you deal with overlapping crises. And unfortunately in One Health, we have lots of overlapping crises. So I was wondering if the other panelists, especially the Stacy and team, would maybe talk about whether that resonates with you from an Indigenous perspective and how your communities deal with this idea of crises on top of crises.
It's a really good question, and I also want to offer, if you'd like to jump in on this too. But I guess I was, yes, in your talk, I was just thinking about, again, when I was showing the photos of what Scammon Bay was doing during the pandemic and the crisis, but we absolutely did see an unfortunate intensification of the other public health crises that were ongoing around suicide in particular and substance use disorders and the consequences there and all of that. You know, COVID really kind of increased all those hard to define risk factors for mental health and other. So it just was this, I don't know, they're referring to this now as a syndemic. Like we have this like collision of pandemics creates a syndemic effect. And, but again, that's where we really were looking at, okay, then we need to look at what is underlying, what's underlying all the crises in terms of solutions. And so, yeah, I guess maybe not be fully directly answering your questions, but we definitely saw it. And, but even prior to COVID, we were experiencing multiple colliding crises and again, that's why we really need those holistic solutions. So, did you want to add anything?
Yeah, I'll just add one thing. Thank you for that answer, Stacy. And I really love what you guys spoke about in terms of solution-oriented work rather than just identifying, identifying areas of need. In terms of all the different types of public health and environmental crises going on, I think one very broad thing that can be lifted up is the fact that pandemics like COVID-19 doesn't happen inside of a silo. It is how we all experience this pandemic is going to be very determined by the space in which we live. And our not just the space we live in now, but our population history and the way that our the people who came before us experience pandemics, because there have been many in the last just 100 years actually, and also these other types of public health and environmental issues. So I think syndemics is a great word. We draw on it a lot in anthropology, and it also speaks to how when we think about solution-oriented work, it has to be very specific to the communities with which we work, because the solutions that are going to be great for the communities you work with are not going to be able to be transplanted to whatever space you can think of. And so there's a lot of work to be done in that area.
We have a question from online from David and Lena for Dr. Rasmus. Have you noted a decrease in suicide among youth as a result of the Weathering the Storm program?
I think the question was whether or not we've seen a direct decrease in suicide as a result of, and I'll just correct the name of the prevention project is Kunazovic, Tools for Life. That helps young people weather those storms. So that's a good question and one that we are asked, but it's a bit of a complex answer in terms of, again, what we measure. So we have multiple different types of measures, but we measure as our outcomes. We measure building protective factors. We measure reasons for life. We measure reasons for sobriety. The community wanted us to change the narrative from suicide to community and cultural strengths. And they, in a really powerful testimony, an elder said, and I'll never forget, said, it's not that we just of course we don't want our young people to die, but we want more than that. We want them to want to live. We want them to be proud of who they are. We want them to know who they are, where they come from. Measure that. Do that. Yes, and that will stop suicide. And so that's our measures. And then also just from a science standpoint and perspective, it's extremely difficult to measure a phenomenon, well, unfortunately, and again, unacceptably, too common. Suicide is still rare. And so we can't really track and measure that outcome over time. It just wouldn't be a good variable. And also asking questions around the common practice in suicide prevention to look at outcomes is to measure suicide ideation or attempt, although there isn't great data that those actually correlate significantly with suicide death. But measuring suicide ideation, thoughts about suicide, in a community where everyone thinks about suicide. It affects everyone all the time. It's almost unethical. And so all those considerations, again, so what we do and what we did is we had to develop, and that's that 20-year process, we had to develop the measures that we use because there weren't any measures floating around about UPIC strengths. And so that was part of that whole process of what we did before we were engaging young people in all of these amazing teachings, was to develop the measures so that, and absolutely does reasons for life, protective factors, associate with reduction of risk for suicide. I really want to give this a Jim, but did you want to add any? I guess that was,
Do you want to make a comment, Jen?
He's our measurement guru. His UPIC name is given to him as Chukyun. That means measuring stick or measuring tool.
Yeah, real quickly, it's a really good question, and it's highly controversial, and I want to acknowledge here's a real interesting case of co-production of knowledge. The community leadership, the elders. I remember one day an elder talked to me when we were going to use a measure with young people that probed for suicidal ideation. And he took me aside alone after a community meeting, and he said, if you observe young people carefully, you won't need to ask these questions. And in some ways, he reminded me that we as clinicians sometimes ask people insulting questions we don't need to ask to find out important information on. And so we went back to the drawing board and we put together a measure of reasons for life. Reasons for life is a protective factor from suicide. It's different than risk. It's kind of fascinating. You can have high risk and you can have high protection, and that leads to less suicides. So you're asking a very complex question, and in addition, one of the things that held back research in rural Alaska, that the suggestion of these elders causing the scientists to rethink how we were going to measure outcomes allowed us to do, is if you talk to any statistician and say, can you show that your intervention in this small population community affected suicide? Of course you can't, because there's maybe only one or two suicides a year. Only one or two suicides a year is unacceptable. But statistically, you can't really show your intervention worked with those kind of numbers. What we do show instead is huge growths in what young people describe as things in their life and their life experience that are protective from suicide. And scientifically, using Western science, we could conclusively show the intervention does that in small communities with small populations.
Chika Okafor from the University of Tennessee. I want to thank all the presenters this morning, but my question specifically is going to the microbiologist. Thank you for all your team is doing, looking at antimicrobial resistance on the One Health realm. So having found the high prevalence of antimicrobial resistance challenge among the wildlife, I know your team is looking at exploring the actual or potential route of that exposure. Do you think there is any value in also looking at the agricultural produce around these communities to see if there is any challenge of resistant genes among the agricultural produce?
Again, that's a good question. And in all serious combined, one of the things that we were looking for in transmission is not only some of our highly vulnerable populations. So our housing insecure individuals often have poor access to clean water. So the concept of washing dogs' feet and stuff, they live with their dogs, they live with the animals, they live with the scat. And we're really concerned how much colonization that is. Some of our research design actually came from agriculture. One of the things that we noted is that in birds, so you have turkeys and chickens, and that if they inhale the aerosols from the scat is when they often will colonize themselves. And so we see in agriculture antimicrobial resistance that's colonized by workers because they are handling agriculture that have been given antibiotics. So, you know, there's been a whole history of the United States giving antibiotics to animals to increase produce and that kind of thing. So we started from there. Our concern is that, so how is this happening? So the small model that we had, where we had the neighbor dog actually had it, found out that dog actually dug the dirt. And so we were thinking this as an aerosol transmission. But at the same time, we can't inhibit the fact that the water can be contaminated and the fecal matter and the soil. So to us, it's a concentrated. I do know that in Anchorage, I've talked to the medical community, actually we spoke last month, that there's colonizations of these antimicrobial resistance organisms they're finding in their human population, and they kind of like, well, where do they come from? So kind of an answer to yourself is, I'm concerned about ag, I'm concerned about vulnerable populations, I'm concerned about our veterinarians, those that have the high risk impact with it. Now, Alaska's not a big ag state, but it's not hard to transmit the fact that this also could be in the lower 48. It's kind of like, where is this all coming from? It's coming from the birds, more than likely, coming from close impact to humans, coming from poor housing and poor water. So yes, I'm worried. I'm truly worried. So what we're doing and our team is we're growing it. We're saying it's there. We're saying this is the impact that we have in here and trying to partner with other universities to see what their impact is there, including Tennessee. I hope that answers your question.
Jaime?
Thank you very much. I'm Jaime Gonzalez from the Nature Conservancy in Texas, and I guess my question is to the indigenous leaders. Many of us come from big cities or places where indigenous knowledge and science and presence has been erased, and yet it seems like this is the moment to refocus on this holistic view. So what advice might you send us home with in terms of reactivating, reanimating, bringing that presence for a more holistic future, especially for those of us where it has been intentionally erased?
I truly believe in our elders, their knowledge, and we take those protective factors, we lay them on the floor, and lay them on the table, and youth will come. In an urban setting, you know, when we identify, if we identified a family in an urban setting, the common things that the people have in that urban setting, what are the common things that they share? And even that's a family. I also believe there's a communal place no matter where you go. And you could adopt and adapt this model anywhere you go, as long as there's there's commonalities, there's love, and there's care for one another.
Yeah. You know, when we think about our Creator, we were given special gifts for our way of doing things and our way of life. And our Creator provided for us of what we have. And there's a reason for, you know, our values within our family systems and our culture. And, you know, when you take a look at the whole universe, you know, there's all types of different indigenous people, and they all have their own practices, and each culture is different traditionally. And we, the Yupik people, were given qaziks and the roots to our values, our families, and they are the foundations. And when you understand your roots and your family values by those standards, you learn to respect, and you learn how to respect your body and your kinships within your family systems. So that's how it starts. You may have a settings in the urban places, but, you know, going back to the roots of your family values, the standards of healthy living, and that's the place to start.
Okay, I just have to say one thing. I think it's the responsibility of everyone in this room, though, to not accept erasure. Native people, indigenous people have not been erased. We have not. so no, but I really appreciated your comment, and it's something we talk about a lot, too, is, yes, I mean, I think it's our responsibility to wherever you are, whatever lands you're on indigenous lands. And so get to know the people, and there are people there. And in urban centers, there are Native people, and actually more Native people now live in urban centers than in reservations or out in villages. So, I just, and I'm excited for kind of a resurgence in our nation of wanting to, you know, learn, co-produce, collaborate. So thank you.
Thank you. I'm Kristen Jankowski. I'm a veterinarian from UC Davis. And just following up on what you said, I love how when I looked for a conference like this and stumbled onto this, I stumbled onto it and was so pleasantly surprised how it involved community members and educators and just a huge range. And it wasn't just the veterinarians and the physicians and the PhD folks. And that was why I came here. But I wanted to see if UAF is doing anything to bridge the gap of the huge devoid that we have in our educational systems within the US to get this word out. So for people coming from Texas or Tennessee or California or Alaska, I think Alaska's really, your programming is really leading the way in showing us the value of the indigenous communities. Yet that seems to be either I'm just missing a lot, which is absolutely possible, or that it's just not happening yet throughout, let's just say, the lower 48, because that's where I am. Are you aware of anything that's on the horizon to connect this great message to the other states, to the other university systems? I know the AVMA has led a One Health mission, but I'd love to hear more from any of you.
If it's okay, I might take that question just because that's what we do. So here at UAF, because we have the Center for Alaska Native Health Research, and we're building a new Center for Indigenous Studies, that is really at the heart of what we do. And we're starting to realize how very important that is. So we have programs ourselves, and we partner with programs. And you're going to hear about some of them later this week. So on Friday, we actually focus on that, how we're trying to flip the paradigm of education. So it isn't us just didactically talking to students, but it's also taking them out and having them do things and having elders teach them. I'll give you an example. There's a great program that you're going to hear about later this week called RAISER, which is Rural Alaska Students in One Health Research. And I'm not going to let too much out of the can because it's a great program, and I'm going to let Ellen Chenoweth talk about it when she speaks later. But basically what that program focuses on is having people within the community with indigenous and traditional local knowledge mentor students along with people from the university in partnership with the Sitka tribe and studying areas that are really important for those communities. For instance, monitoring shellfish for paralytic shellfish poisoning, or microplastics in the water. And the students can see the direct result of how their research benefits their community. So it flips the paradigm. Research is no longer an extractive process where we helicopter in and say, hey, you guys need to help us because we're researchers. It's like, what's important to you guys? And how do you want to approach this problem? And how can we use your knowledge to train these students? Instead of us going into a community and saying, hey, we're going to take your best and brightest students, we're going to take them to UAF and train them up to be just like us, and oh, by the way, they're never coming back. Isn't that great? That is not great. But if we can say, hey, why don't we train them together? And so that when they come out, we have a great program you're going to hear about later this week too called DMUMTA, which means all of us together. And that's a program that uses that concept, using elders and people with traditional knowledge as well as Western science to train people who are going to manage resources. And it's again, a paradigm flip. We have programs like that from high school, undergraduate, the BLAST program that we have here at UAF, our One Health Master's program, our veterinary program. And so there are many, and the DMUMTA program, which I think is a fantastic example, and that's a master's program as well. So we are trying to flip that paradigm, and these are extremely inclusive programs. Our One Health Master's program, we have a fellow from Sweden here, Daniel from Sweden. We've got folks from Nantucket. We've got folks from all over the lower 48, Canada, and all across Alaska. So, and you'll get to hear more about those programs later this week. But yes, the short answer to your question is yes, we are trying to change the paradigm, and absolutely we're trying to get the word out.
I have a question for Simeon, Stacy, and Billy. I was wondering if you guys could talk a little bit more about the future of Rungazirik, if you plan on partnering with other villages or collaborating with village healthcare systems. Rihanna.
I like to say before network came, our people were networking. They shared those values from region to region. And that solidified why, we do things the way we do. And we've found that, this is true because we went from region to region and they shared their knowledge. And there were from separate regions that were co-talk and people that could understand from both languages in some of those borders. This is really important, and this is why I think the work that we do in Yukon Delta or in the Yupik communities works because we have weekly gatherings and we share with one another. And we have this common language with one another, and the value, the love, and the respect for one another. So partnership, is really key to make this thing continue. Not the way of life to continue. Some people call it a program or a project. No, it's a way of life.
Yeah, just like what Billy said, our leaders have always been in constant contact with each other. And,
You know, there's lots of unspoken, um, values that our ancestors have always shared. And I remember my late father used to be in contact with people from the Yukon area, Kuskokwim area, Bristol Bay area, to reassure of what their communities are doing and keeping in contact and making sure that the youths are well taken care of, and observing them and sharing what's going on with their issues within their villages. And they would come up with, okay, this is where we're at, and that constant communication of constant reminding of yuyaks, and reassuring each other, okay, we're okay. And if there's an issue with in their communities, you know, I need help in this area. Can you help me? And that networking, and those are the tools that they use. Kungazvik is, you know, it means, you know, in the Kungazvik, there's tools that they use, and they open that tool to work on what needs to be done within their communities.
I think this comes from what we do in our potlucks. We invite one community that represents the people that have gone before us. And in the same way, they do it again the other way. The two communities working hand in hand, each looking accountable to one another, so that there is a protocol that you do during potlucks in these ceremonies is as true as it can be with what we have. But we don't call it potlucks, we call it zurokachsuk. It's forcing an encounter, and that's our spirit, our ancestors coming to our community, and we do the song and dance for them.
Now I hate to take it here after that beautiful spiritual. I got to be a little bureaucrat. I'm going to be a bureaucrat right now, just for a minute, because that's a great question. I do want. Our team is asking ourselves all the time, what are our next steps? And as I said earlier in the talk, right now we've been pretty much entirely federally grant funded through research grants to do the intervention. And so we definitely within the YK region have had other communities outreach to us. And ideally, in the ideal world, we could just leverage that UPIC network and be able to do the sharing of this knowledge and, you know, get everyone in the Kazakh together in that region. But today, the way of life, the world has changed, and the way of life now does require resources. It requires cash resources. You need gas to fuel those boats. Very literally, our supplies budgets and our grants, you know, we need $20,000 a year for gas. That's what we need to do this, to get young people out. Some communities have to go pretty far distances. This is just a reality. And so, you know, one of the whole purposes of us doing the research and creating that evidence base, because as I said, the communities don't need to prove anything to themselves. But again, we felt, you know, we had to do that because right now we're seeing the channeling of Medicaid, Medicare, you know, federal funding for healthcare, IHS funding for healthcare that goes to the health corporations, but you can only bill for certain things, utilize and implement certain practices. They have to be evidence-based. And so again, we did the research to establish this as an evidence-based practice that could be built into treatment plans and funded. But essentially we're building towards implementing it as a traditional practice within a healthcare system. But right now, I mean, we are still doing the research. So very practically, our next steps are to do just what you said, is to, we're gonna do some dissemination and implementation for folks in the crowd, but we're gonna really study how to implement this project, both within other communities in the region. We've got 5 active communities, but we have communities, like I said, outreaching all the time. How do we get Knutsavik? Of course, you know, it lives in the communities, but again, it's more how do we get the resources to really engage, like to hire a full-time person, to people to be doing this work in our communities. And so, you know, again, I help tribes write grants, or our center does. You know, there's many things, but really we need policy changes is what we need. Anyway.
Yeah, it really come to mind about the appetite that our people have for this project, or not project, but our way of doing things. And, you know, food is something that bonds people together, you know, and sharing a dish. And we have an appetite. Our youth have an appetite for this, and we want to share our bowl of food with them. And, you know, having something like this in common that's not foreign to them. They recognize our values and our culture. And like I said, you know, this is not something that it's not foreign, and it's always been taught by their parents and their values and the reasons for life, you know, giving them hope and being proud of being able to share the food that they catch. And, you know, it makes you feel good when you're giving food and seeing how they react. And those are the things that, you know, help build the youth to want to live and the reasons for life. So I'm glad that you brought that up, and I wish, you know, it's something that we want to expand.
Hi, Jessie Kennecker from Emory University in Atlanta, Georgia. In regards to the COVID-19 and One Health, you mentioned the impressive vaccination uptake that was so successful here, and part of it, of course, was the want to be taking care of and helping protect others. But the other thing you attributed to was local government. As someone in the lower 48, where there seems to be little to no trust of any type, what is it that the local government is doing differently that it was able to instill so much trust, or how are they so successful so that we can kind of encourage that?
Something that we learned about in the interviews was that at least in these smaller communities in Southeast Alaska, people were much more likely to personally know people who were in charge of making decisions, to the point where even if you didn't agree with a political decision, you could still understand why it was being made, potentially for the better of the community. Just to give kind of a frame of reference, those small communities are, you know, a few hundred people. I came from a relatively small town in central Missouri, but our population's like 140,000 people, and like that's what we would consider a relatively smaller city. I don't know anyone who's making decisions in my community necessarily, and that's on me, right? That's on us. But it has a lot to do with how united the people were in these smaller communities. And maybe I'm not the best person to answer this question. If you have any insights into that as well, then I would love to hear them. But that's what people talked about in their interviews, being able to trust the people that they knew personally.
guys want to address that, or?
In a small community, like 800 to 1,000 people. No, there's 1,000 in my community, I think. But you do know your leaders. That was mentioned. But the people also, and we mentioned this earlier, that they're always looking out for one another. And that's that families, that family system again. I think that's one of the reasons why, because they're always looking out for one another.
Thank you, Billy. That's a great point. It really is. I think we have a question from someone online. No? Okay, Elizabeth dropped a note and said, please. Okay, if anybody online would like to ask a question, please go ahead and send it in. Any other questions here in the room?
I had a question for Dr. Emilio. In this context where communities are dealing with these overlapping crises and there are multiple different things at the front of mind all the time, how would you make a case for investing in an issue like ticks that is perhaps modest right now but is not going to be modest at all in 20 or 30 years? And where would you point to getting started in an environment where costs are very constrained and it's very difficult to get things off the ground?
You know, that's a great question. As you had asked the previous question about, you know, multiple epidemics and how do you farm out money and there's money for this but not money for some other project that you may be interested in. That's always a struggle of public health, or at least the people that I work with. So in my mind, you know, it's difficult, and it's difficult because I've seen funding go, you know, extremely well to basically dry it out completely, and then having to find, you know, I'm one of these people that I'm always begging and crying for money. Like everybody, if anybody has $100 left, I just kind of beg and cry and then get the money and move it on to my project. So I think within the realm of public health, there's a lot of priorities, and within those, you know, people at CDC, which is the funding mechanism that we use, provides us with a little bit of money here and a little bit of money there. And we use a lot of our community members, and we use a lot of the people that really care about tick-borne illnesses, for example, to go out and collect ticks and not charge us anything. And we use laboratories in which we, again, beg and cry and try to get a lesser price so we can actually get testing done. And a lot of it is just a matter of people being so interested in the subject matter that we are at times able to get away with minimal funding and actually make it relevant to what we're doing in terms of human infection, animal infection, One Health, and what that means, and that what will mean in the future. So there's not really a true answer as to, you know, do I have this formula and that works every time I ask CDC for money? The answer is no, I don't have a formula. But I do, with whatever little I can get from even other projects, make a project that is so relevant to at least a community that they actually start thinking about it. If not acting on it, thinking about what is it that they need to do next. And to me, that's what makes sense, and that's what I want to promote in different communities throughout the state. Thank you.
I also had a question for you, Dr. DeBoss. You mentioned during your presentation how ticks populations were continuing to expand despite climate change. And you even showed off some pretty fascinating tick maps from Europe that were kind of displaying and projecting how these populations might expand 40 to 100 years into the future. And that got me wondering, are there any current strategies in place to reduce the expansion of these ticks? Or is there anything we can do to help prevent this expansion? Or are we utterly hopeless to these bugs?
Hopeless is a great, yeah, we're not hopeless, obviously. You know, that's a great question, because when you talk to people about management of ticks in an area, nobody really has the right answer for it. I think multiple people have different approaches to ticks in an environment of any kind. And I don't think we have a one approach to the management of ticks. We do know that ticks are changing as climate is changing. They're adapting as the climate is changing. And the ability to adapt so quickly is what's really making them so successful. So yes, we do need to come up with a better way to do this. The problem is that when we start thinking about it, we think about chemicals that potentially could be very harmful to the environment, and we have to think holistically and globally as to what we're doing to our environment to protect us against ticks. So I think there's not one approach, if that's what your question is, but I think we're trying to come up with probably the best way to manage the tick populations in different areas as they grow. We don't have an answer just yet, but I think that's coming, and it's coming soon. Thank you. Yeah, go ahead.
Restman, I think you felt sorry for a bunch of mice that were on your slide. And Dr. DeBess and I giggled at that, because we often talk about vector control as a way to manage the spread of disease. You know, we don't have great ways, let me just say environmentally friendly ways, to control large amounts of ticks other than the ticks that get on our dogs and cats, right? But when we take it back to vector control, that is one way that we can prevent the spread of disease. We might not be able to prevent the spread of the tick themselves, but we can control the host reservoirs that carry the diseases that the ticks then transmit to innocent dogs, cats, and people. So, Dr. DeBess, I don't know if you had a comment on that.
Yeah, so forgive my ignorance. I don't know if you guys have vector control agencies here in Alaska. In Oregon, we have vector control agencies, and what they do is they actually track and collect mosquito populations, and then we test them for West Nile, Western equine encephalitis, St. Louis encephalitis, and any other pathogens that we can come up being creative about it. They are now, at least in Oregon, they're now getting interested and engaged in ticks and tick-borne illnesses, and potentially developing a way of managing populations. I think Amelie is right. We gotta protect our pets. There's medication. There's medication. There's things that we can do to protect our animals and humans, and that may be just a first step to prevent disease that are transmitted through ticks. Thank you. Yes.
Can I add something to this conversation? Deborah Thompson from One Health Lessons here. So in addition to just depopulation of certain hosts and vectors and such, there are vaccines actually for Lyme disease at least, that's an oral bait for some of the mice populations that can carry Lyme disease, Borrelia burgdorferi. Do you know of any other vaccines for wild animals when it comes to vector-borne diseases that are in the works?
I do not. I do know that the University of North Carolina is working on developing a vaccine for humans now. It's a new kind of way of creating vaccines, and they're using the animal models to actually create a vaccine for humans. As for any other ones, I mean, this is the first I've heard about Lyme disease vaccine in mice. Is that what you said? Poor little ones.
It's an oral bait for
yeah,
mice.
It's an oral bait. Much like we have the rabies vaccine, which is, you know, an oral bait for wild animals as well. But I'm not aware of any other ones. Thanks. But that's great. Dr. Bender?
As far as oral rabies or oral vaccines, the rabies vaccine, there's several different types of those available now. Europe has several oral vaccines, as well as the Canadians have the ONRAB. We have VRG. We do have the oral plague vaccine that has been very successfully deployed in Wyoming and Arizona, actually using drones to get it out there to the prairie dog populations. There are a few other vaccines that are being looked at. The biggest problem is being able to deliver them and deliver them in an economic, when we're talking a huge population of wildlife, along those ideas. There is also now a oral rabies vaccine that's being looked at for vampire bat use in Mexico. There's also a new vaccine using alfalfa fed to cows to vaccinate them against rabies that's in study right now. So this is a very dynamic point that we have those vaccines available, but then still getting them out there, being able to utilize them into a wildlife population, into a urban wildlife threshold is really where the next challenge, besides making sure that these actually work as well. And then there is a vaccine being looked at very specifically for vaccinating cattle that actually kills the tick specifically. So it's targeted towards the intestinal system of ticks. So there's some really neat, dynamic vaccine work that's being done right now in research.
Thank you.
You know, that's great. At the same time, I know it takes a while for those vaccines to come to market or be available. And I think we've seen that through other vaccines as well. But I think in the meantime, prevention, right? It's a key to success and how we can protect our animals and humans. And in the meantime, just wait for those vaccines to move forward and be available in the market. Thank you.
Thank you. Time for one more question, Mariana.
Thank you. Marianne Lian, Inland University, Norway. First, thank you all for very nice presentations today. And I just actually have a comment on the tick discussion, which wasn't actually my original question, but I happen to know that in Europe there is a human vaccine against tick-borne encephalitis. But that wasn't actually my question. My question was about the urban moose. And I was wondering, these bacteria you were finding, are they a part of the microbiome in moose, or are they pathogenic to these animals?
So that's the thing I get asked a lot, because there have been, one of the things I always tell whenever my students have spare time, I says, I want to know, search the literature. Can you tell me if there's E. coli in moose on a regular? And that's not something that's really studied that much. So what we have to focus on when we're looking at our research modeling, and I remind my students this, is that it is interesting. I think that I don't know how many percentage of moose are carrying this and whether it's their normal microbiome or not. I guess I'm not that concerned about, because I just don't have that information available, and I can't, we're not collecting that type of wild animal sample. What concerns me, and this is why, because I don't even know if it's the same moose. We always talk about how bad it is all over Anchorage, and then one student said, well, maybe it's just this one hot moose that just keeps defecating throughout the whole, if you've ever been in Anchorage, usually they're all over, especially when it snows. That's why we look at prevalence and concentration. And my concern is, and this is truly a concern I have, because we also look at enteric pathogens and we look at Shiga toxin-producing E. coli. We look at other things that are being defecated because we also, field dress moose, on the side of the road. I mean, we are doing things that in agriculture we'd have all these controls for, and we're just, gutting them right there, next to the snowbank. So I worry about the fact that when all of that is done and when there's defecated material in there, and it's the only thing that's left in that sample after 6 months of freezing is the 4+ or growth of one organism that's highly drug resistant. So where is that coming from, and why is that the only thing that has survived, coming from the animal, landing on the ground, being in the snow, till we collect it and we refrigerate and freeze it, and we don't analyze it till 6 months later. Then we're warming it up in a nice, warm, moist environment like your gut. And all of a sudden I'm getting this full bloom, because so many times when I see these multi-drug resistant organisms, it's the only thing there. And my concern also, though, is that we had one bear scat that we collected just outside of the Anchorage Bowl area. And not only the only thing that grew was Escherichia coli, the sample, it was a Shiga toxin-producing Escherichia coli. So in other words, it had the capability of producing Shiga toxin E. coli. If you don't know where about, that's that hemolytic uremic syndrome. And it was an ESBL-producing and multi-drug resistant. And that was the only thing that was growing when I cultured that sample. And when I mean growing, those Petri plates, it's 4+. So I'm worried about that. I don't know why that happens, so that's what we focus on. We focus on the risk assessment for somebody walking across that moose scat. What are the chances that they're going to pick something up? And because it is so horribly contaminated, even after all this environmental impact, I'm worried. Do I think it's in all the moose? I don't know. Do I think it's their normal biome? I can't find it out. Will tell you, though, I was talking to a researcher up at the UP in Michigan who actually talk about moose too, and they are thinking that the antimicrobial resistance, especially to cephalosporins, could possibly be that when they're eating the plants, we spray for spruce beetle here. And so we're always concerned about what we're doing environmentally to our own plants, that they're actually somehow managing to get that resistance. But besides that, I don't have an answer for you, except that I'm concerned that there is so much in the fecal matter after everything else is done. So our next step is to see how can we eliminate this fecal matter without then exposing ourselves to high risk. So we're looking at things that agriculture already does, like drying it out. Can we then, once it's dry, can we handle it without colonizing ourselves? So again, it's a real concern. And if you want to get some really scary data, just come up to me later and I can give you some information.
Thank you for that. All right, well, that concludes our morning's session, but a few housekeeping notes. Lunch is being served over here at the